The business tip that we have found is there are a lot of people that are out there wanting to help startups. So being able to recognize that that kind of help, you need that help. You need people that can give you the advice and help you get down the path that you need to go on. And I think having the patience and the persistence, it's one of those things that you can't be too patient, but you can't be too eager as well. So having a good balance of those.
Welcome to the Wellness Growth Code podcast. I'm your host, Justine, and this is where we talk to leaders in the health and wellness space about what's actually driving growth right now, from visibility to smarter systems to AI. No fluff, just real insights you can take and use in your own business. So let's dive into it. Today, I am joined by Tim Ecklund, who comes from a long career in higher education and student affairs and is now working with MindArc Health, building AI-powered tools to measure and strengthen psychological health. Tim, rather than me doing you a disservice and reading out your bio and all your credentials, do you think you could tell us a little bit about you and what MindArc does?
Yeah, sure, Justine.
And welcome.
And thank you very much. I'm glad to be here. So my career, as you had said, has really been in higher education and working in the area of student affairs. Probably the role that people would most relate to is the role of Dean of Students, where I spent a number of years as a Dean of Students and at different size and complexities of institutions, large research institutions and small liberal arts residential campuses. And one of the things that was consistent throughout those institutions is that mental health, behavioral health is a real challenge. And some of this has to do with the human development behind the college age going individuals. But I think it also has a lot to do with a symptom of what I think are seeing across our society as far as the stress-related disorders that appear because of poor mental health. So one of the things that I was dedicated to was to see how we could do this better. And I was fortunate to find Nadine Wilches, who is the founder of MindArc Health, and become one of the co-founders and owners of the company, which is focused, as you said, focused on trying to improve psychological health much further upstream, looking at it from a preventive lens, trying to do the things that we can do to strengthen our psychological health rather than seeing psychological health from a disorder and disease perspective.
I love that. And why do you think, like even backtracking right now, like mental health is on the rise? Like it seems to be getting worse.
Well, there's a lot of different ideas around that. I think that one of the things that we don't really consider is the impact of the pandemic. It seems like the pandemic was there one day and then it was over, and that we really didn't pay attention to the psychological damages that may have been caused, or how it may have stunted psychological growth, or how it may have just affected how we feel about who we are as human beings. And I think for me, the population in the sector that's most familiar to me is the higher education sector. And you see this with students. There's been a rapid rise. When 10, 15 years ago, we were probably looking at 20, 25% of students indicating that they had some kind of psychological challenge or issue. There was a study that was done, Thriving in College, or I think is the name of the study, that was done last fall, and that number is up to 70%. So it's just been exponential in how it's continued to increase. And campuses and I think other social service agencies and other units like that are overrun by the demand on psychological interventions and crisis interventions. And that's why it makes so much sense to try to address it at a much earlier formation.
And that's what MindArc, that's where you enter. How does it help with the early intervention?
Yeah. So what we've done is we've kind of thrown away the the disease and disorder approach and have looked at it from a salutogenic approach, where we want to see our psychological health absent of disease and disorder and try to understand what are the things that go into that. What are the most important factors that we can have some kind of impact on that could strengthen our psychological health before it gets to the point where we're needing some kind of clinical interventions. So what we've been able to do is boil it down to 5 foundational elements, and those elements have 2 different features. So we looked at over 2,500 research articles and did a factor analysis to try to figure out, okay, so what's most important when we're talking about psychological health, especially from a positive psychology framework. And we were able to find these 5 elements. And the 5 elements have both internal or psychological features and external or socioecological features. And what we have gone further and been able to do is to come up with an instrument that assess those to allow individuals and organizations to have a understanding of the dynamics of these psychological elements that are so important to our psychological health. So I think the other thing, Justine, that's probably most important is how we as a culture look at mental health, and it's usually from this disease disorder perspective. So when we talk about it as anxiety and stress and psychological dysfunction and all of those kinds of things, rather than creating a culture, which we're hoping to do with our approach, that can talk about psychological health the same way we talk about physical health. Did you go to the gym today? Are you working out? How are you feeling? So we have those kinds of conversations and get back to understanding our psychological health from these areas that are so important to how we grow as humans.
It's, it's so important, but I see the younger generation very much more open than people like myself, late 40s, especially. My mum was staying with us recently, and there's no talk of feelings. You don't even go there. But it feels like, yeah, people, and I don't know if it's a cultural thing too, but here in America, when I moved here, I found a lot more people were talking about like going to see their therapist, and it's starting to be normalized. Whereas in Sydney, where I grew up, it just wasn't something you talked about. And maybe maybe it's becoming more popular.
Yeah, and I think what you just said is the great thing and the challenge, because it's a great thing that people are talking about their psychological health, but they're usually talking about it in that framework of I feel anxious, I have some kind of anxiety disorder, or I'm seeing my therapist this week. All good things, but it's absent of this conversation about how can we how can our mindset and how can our thought process incorporate in there what I need to do to kind of strengthen those things that will make me feel better all the time.
And when we were talking in our pre-call, you said something that kind of struck with me, that most of the funding these days is going towards intervention, not prevention, which you kind of touched on.
Absolutely.
How does that impact your ability to grow something like this?
It's the biggest challenge that we face. And as a small startup, social enterprise organization, our margins are very thin. So, trying to get people's attention on this has been a real challenge, because so much of it is spent on trying to put out the fire rather than trying to not allow the fire to start. And I can understand it completely, having been a administrator in higher education for a long time. Budgets are very, very reduced from what they were at one point in time, and a lot of decisions have to be made on priorities. And I think our hardest, most difficult challenge is to try to help people to see that prevention, a pound of prevention is worth, what a an ounce of prevention is worth a pound of cure, I think is what we would hope, but that's not how people function and how organizations like higher education institutions prioritize how their money is spent. So we talk to people. They say, yes, this is great. This is what we should be doing. And then when we get to the point of how to, how to pay for what it is that you need to do, it falls short. I think the thing that we're seeing, though, is there are more people than 2 years ago that are seeing this as a solution than had been in the past. So I think it's growing. I think the understanding is growing. And I think the way that we're able to make sense of this has been getting more traction, which I think is very hopeful for us.
And what kind of trends are you seeing right now, whether in the mental space education area? I mean, you mentioned before, I think schools are pouring money into counselors.
They are.
But like, yeah, is there any trends you're noticing?
Well, Justine, one of the most interesting factoids is that the 70%, as I mentioned, 70% of students are indicating that they have issues with the psychological issues that need to be addressed, yet only 15% are indicating that they're getting help from the resources that are available on college campuses. And I think it's somewhere around 30% overall are getting psychological help. So there's a big gap in between access to psychological care. Even with those smaller numbers, campuses and I think social service agencies are really overrun with people who are needing psychological care. And if you think about it, if all 70% of the population wanted to use the services that are available, they wouldn't be able to because they are not available at that level. So it is a really big problem across higher education and I think across our communities in general. And what we're trying to do, because our approach is not just at the individual level, we've designed a way to help guide communities in looking at the things that are in a community that could be done that would strengthen psychological health, and those things that are being done that are doing the opposite and affecting psychological health in a negative way. So it's a socio-ecological approach that I think the two go hand in hand. It's important for individuals to work on their own psychological health, but because environment is so important in our psychological health, we can't do it in a capsule. We really have to do it jointly so that we get the full effects.
And switching, I guess, to the business and your background, you've kind of been in this space, in the higher education space, and now the intersection of like AI and psychology and building MindArc. What experience or lesson stands out the most when you look back that you could like share with our audience in terms of building something?
Yeah, I think probably I think you have to be in a position where you don't put boundaries on what you think is available and how you want to position yourself. So 5 years ago, what we have, because our data assessment, our survey is all AI driven, our process that we have in place for communities as they develop strategies for building psychological health is all AI powered. The things that we're able to do now were just unthinkable, impossible at that point in time. It seems like we've just made this huge jump. So I think one of the big suggestions is to not always think inside the box that you're in and really push yourself. We have great thought partners. I think that's one of the strengths of our company. We're very intuitive in our approaches, but we have advisors both in the business side of what we're doing as well as the conceptual side that we're doing. We actually, one of our really great opportunities came recently where we were able to do a call with Marty Siegelman, who is the father of positive psychology. He's a longtime professor at Penn, University of Pennsylvania, and it was really refreshing to be able to take what we're doing and get somebody who's had such a long and um, powerful impact on psychology to take a look and give us the kind of, new knowledge that we might need to continue to grow what we're doing. So it's a combination. It's a balance of, having ideas and not limiting yourself, but at the same time, you have to anchor yourself to the business principles that are a part of what you're doing. And I think for us, having folks advise us who advise startups has been probably most important in that.
That's great. And then I guess now, like, where to with MindArc? What are the big goals?
Oh yeah, it's things are kind of exploding for us, which is really great. We have expanded into the healthcare sector from higher education and K through 12. Uh, what we're hoping to do in healthcare is to help practices and organizations, healthcare organizations, to be able to do more with behavioral health. You probably have had the experience where you've gone to your primary care physician, and if they're doing what they're supposed to be doing, will have received a survey that you filled out prior to your appointment, where you answered probably 10 to 12 questions that are all based upon your behavioral health. And you probably turned it in and had nobody say anything to you about it. It just became a document that exists. What we're hoping is by combining what we're doing with psychological health, to be able to give practitioners, doctors and nurses and PAs and NPAs, an opportunity to talk to patients about their psychological health along with their physical health.
And then, in terms of, I guess, if you had a magic wand that you could fix one thing in the business right now, where is the struggle point right now?
Yeah, that's a really great question.
Funding,
Yeah,
probably funding.
pretty challenging. Well, it is. Um, funding is there. It takes too long to sometimes get the funding. So funding systems, which they need to be, are fairly slow and do a lot of due diligence because you don't want to be giving money away to or buying things without knowing that. I think it's really if I had to a wand to wave, it would be to help people reimagine their psychological health. I think if everyone could reimagine their psychological health, what we do would make so much more sense as something that's not a choice, but that's a need. And I think that's where we kind of are struggling in helping organizations to see that this is something, if you're going to have a productive workforce, if we're going to have productive and successful students, if we're going to have people who are able to affect their physical health through their good psychological health, then everyone has to reimagine that psychological health is something not to be afraid of, but something to embrace and something that we can work very easily to improve and talk about and work with each other.
I love that. And the common thread whenever I've been interviewing people on this podcast, all entrepreneurs, and I ask them like their advice and what they want to share. And most of them are saying like, you really have to know yourself and the importance of knowing who you are to be successful in life. And that really hit home. And I was like, oh, I don't think I've ever studied myself.
Right.
So like, I don't know if it ties into what you're
Oh,
saying right
it does
now.
exactly. And not only know yourself, but be able to talk about it with others, right? To have the confidence that you know yourself well enough to be able to have that conversation, demystify it, destigmatize it, and be able to do the kinds of things that we're able to do as humans that are so unique, and being able to help each other become better people and a better society overall.
And for someone that's listening that might feel overwhelmed, where would you, or, struggling, where would you recommend they
As
start?
a business,
I guess or even your survey or personally, what would you recommend?
yeah.
Not as a business or as a
Well,
person.
as a person, yeah, I think taking our survey is a great place to start. We offer it for free online at mindarc.com. It gives everyone that wants to give it a try a psychological profile and an AI generated list. It identifies what probably, so what it looks at is a combination of the internal psychological factors and the external protective factors, and figures out what's the thing that is probably most important. It prioritizes it to the most important to you for you to do to start strengthening your psychological health. And then it'll give you some guidance that will say, you could start doing this, or you could start, doing this, or it gives you prompts for you to think about some of the things that you might want to do and incorporate in your life that will give you that kind of strength. So I think that is a really great place to start. And what we've heard from folks, it's a real easy survey to fill out. It's been really distilled to a point where it's incredibly efficient, and people feel comfortable and come away and say, oh, that really is me. And of course, when you're answering questions like this, it's just really a reflection of, what your state of being is. So I think that's a real helpful first start.
And I like that it's confidential too. It's
Totally
not
confidential.
because I think that's what we worry about.
Yeah, we in this day
Yeah,
and age, you have to make sure that your everything is meets those standards of confidentiality. So yeah, if somebody wants to take it, it's theirs, and we have no access to the data.
I love it. It's called, yeah. So if you go to MindArc, ARCH health.com, it's there. Is there anything else that you want to share with the audience before we wrap up?
Yeah.
Either business tips or, yeah.
I think business wise, it's, startups have I don't know what the percentage of startups actually succeed. I think the business tip that we have found is there are a lot of people that are out there wanting to help startups. So being able to recognize that that kind of help, you need that help. You need people that can give you the advice and help you get down the path that you need to go on. There's so many different ways to go. And I think having the patience and the persistence, it's one of those things that you can't be too patient, but you can't be too eager as well. So having a good balance of those.
Yeah, you've got your mental health too along the way.
Yes, right.
Because it can be there's a lot of moving pieces getting a business up and running.
It is. It is. And it takes, we are a bootstrap company at this point in time. So it takes that kind of willingness to make individual personal investments into the company to, grow it to what it can be. But our hope is that it grows. That's one of the things that probably is challenging for us. We are very passionate about what we're trying to do, but at the same time, we want the business to grow. So there are times, when you're working in that kind of company where you have crossroads, where you really have to look closely at what's best for the idea, and the passion that you have for that and what's best for the company, and how to get the company in a position where it can do the things that you're hoping it to do.
It's been so lovely to find out more about your business, MindArc Health, and go to the website, take the survey. I'm going to do it this week and report back. And
Please.
to anyone, yeah, I will definitely. I know I was meant to, but I will do it because now is the time. And thank you so much. I really appreciate you coming on and sharing a bit more about your business and what you're doing. And everything that you share always inspires other people that are listening, whether it's a simple tip or just, finding out more about great health and wellness businesses. So yeah, thanks for joining
And
us.
thank you, Justine. This is a great opportunity. I wish you all the best with your podcast.
Yeah, thank you so much. And to everyone listening, if this resonated, share it with someone who needs to hear it. And remember, if you want your free growth plan, just DM the word growth and we'll get that to you. Until next time, thanks so much for joining us on the Wellness Growth Code podcast. Okay.
Okay.